Welcome back to Wylde on Health. Well, in small doses, stress can be good for you. It makes you more alert and gives you a burst of energy. But feeling stressed for a long period of time can take a major toll on your mental and your physical health. It can also lead to anxiety, depression, as well as sleeping disorders. Joining us now with natural remedies to help you de-stress is naturopathic Dr. Andra Campitelli, TrueStar Integrative Medical Director and owner of the CP24Feb32012 Health Center as well. Welcome to the show.
Thank you for having me.
So we're talking about natural remedies, natural cures for a number of different things which often don't get the spotlight. The seasonal affective disorder is one maybe we'll talk about momentarily. It's dark and gloomy out there, and you know, we got to get on, especially some people that experience this in a major way. You have a lot of solutions. First, if we have it up right now, the control room can throw it up, what we're going to look at is sort of what's happening in our brain, neurotransmission, neurohormones. You know, give us a little bit of an idea as to why that matters in this topic.
Neurotransmitters play such a big role when it comes to mental health. When we talk about seasonal affective disorder, when we talk about anxiety, all of those things are related to different mechanisms. Dopamine, serotonin, all of those sort of feel-good neurotransmitters that affect our mood, our sleep, just our sense of well-being on a daily basis.
Right?
Exactly.
They're
our
not the sex hormones, testosterone or estrogen that people are familiar with hearing. These are brain hormones, so key. So what, for example, happens with seasonal affective disorder as it relates to these? What goes up, what goes down in some of these situations?
So seasonal affective disorder, those neurotransmitters are really very much related to the light and dark cycle. So for example, serotonin responds to light. So in daylight hours, the serotonin production increases, and it's the darkness that increases our melatonin. So as the daytime shortens and the dark periods lengthen, we get a little bit of an imbalance. We get higher melatonin levels, which encourage sleep, and lower serotonin levels, which are responsible for, again, that feel-good sense of well-being, and different things like that.
Perfect. And what we're watching on screen right here are little what we call vesicles at the nerve synapse, synaptic cleft, that ultimately are carrying possibly dopamine, possibly serotonin that you're describing.
Exactly.
So in the human brains where it all happens at the very cellular level, microscopic level, and this is always happening. And whether we feel, you know, a low mood or have seasonal affective disorder or sleeplessness, these chemicals are possibly interrupted, right?
Absolutely.
Okay. So what can we do? Seasonal affective disorder, what can we do naturally to improve?
There are a lot of different treatments. I always like to start first with a few natural things. So one really great one is light therapy.
Love it.
People talk a lot about, they have the little sun lamps. I really like the dawn simulators. So you can get a sunrise alarm clock. So it's simulating the sunrise in the morning. So what happens is while you're sleeping, about 15 minutes before your alarm is supposed to go off, the light naturally illuminates your room. So you're increasing that serotonin and suppressing that melatonin, so it helps you wake up, helps you wake feeling good, which is a big problem for people.
We hear a ton about vitamin D. 5-HTP we don't often hear too much about. So tell us a little bit about what 5-HTP is and might help in this situation.
So 5-HTP is fantastic. It's a natural precursor to serotonin.
Got it.
So, and it's very safe, a lot of fewer side effects as well. Very effective for seasonal affective disorder. Oftentimes there's a very large degree of depression in there as well. So it's a really great natural supplement for people to give a try when they are suffering from seasonal affective disorder or anxiety and depression.
Talk to me a little bit more about anxiety, depression, because I mean, this is a big, you know, diagnostic statistical manual is so huge for, you know, this is the manual, of course, that we use as clinicians to, and psychologists, psychiatrists use to diagnose people. It's so variable. There's so many different types. But here's the question, what can the average person, even if it's mild to moderate depression they're experiencing and maybe they haven't got diagnosed yet, and they should see their family doctor about it, even if they're feeling sad or gloomy for too long. What can they do, you know, as a nutritional supplement routine to help them out?
So again, there are a lot of really great supplements. So we just mentioned the 5-HTP. When it comes to mental health, fish oil is key.
Yes.
The omega-3s, absolutely. The omega-3s, the EPA and the DHA. If you have supplements at home, read your bottle. Make sure you have the higher EPA in there. That's really great for mental health.
So you got a whole bowl of them here, right?
That's right.
And
we
you've
have
got
some
your
really great
flax
fish
oil
oil
at the end,
yep,
right?
Some flax oil.
How much do you recommend in terms of fish oil daily
fish oil?
For depression?
For anxiety, depression, about 1,000 milligrams of EPA is what you're looking for a day.
Of EPA, so not the 1,000 milligram capsule, but at least 1,000 milligram of the EPA, which is typically roughly around a teaspoon that you're looking
If you're looking at a liquid, about a teaspoon,
right.
And you want about twice as much EPA than DHA. So you still want the DHA in your fish oil supplement, but you want the higher EPA. So just again, read your bottle, make sure you're getting that 1,000 milligrams of the EPA.
Let's talk for a second about interactions. I think it's a really important topic. You know, folks that are on antidepressant medications or anti-anxiety medications and otherwise, what's your advice to them as it relates to the use of these things?
I think consulting your doctor is key. Oftentimes the side effects of the natural supplements are not as great, but if you're already on a medication, it's really important to talk to your healthcare provider to make sure you're taking the right thing. Especially St. John's wort, they're a lot more interactions with that. That's often used in depression.
Right.
It's a much stronger supplement. You see a few side effects with that as well, but not quite as bad as you'd see with, you know, an SSRI or another prescription medication. So it's really important to speak to your doctor so that there isn't an interaction there.
And I throw it out there because it's an incredible, you know, little service that we have. WyldeOnHealth.com. There's a great, you know, little feature called Health Notes. Click at that at the top, and people actually put in, you know, their drugs or natural medicines there, and they can find out more about the interaction. Dr. Campitelli, tell me about the shake you have here at the end of the table. What's this all about?
What is also really great is there are different foods that you can take on a daily basis that help to stimulate that natural dopamine, that natural serotonin. They found that whey protein is really high in tryptophan, which is great for that dopamine production.
Right.
So there are a lot of correlations as well with how you're eating that affect anxiety. So for example, if you're only eating carbohydrates, then you get big spikes and drops in your blood sugar. That can contribute to irritability, to mood disruption. So it's really important if you're suffering from anxiety or depression to keep your blood sugar stable, and that helps keep your mood stable. And
sometimes just the simplest things.
Absolutely.
Right? Getting more active, you know, breathing exercise and routines, making sure we're getting enough sleep.
Exactly.
Right?
Sleep is key.
Right.
Sleep is so important.
Where can people find you?
I'm at the CP24Feb32012 Health Center. I practice at Yonge and St. Clair out of True Star Health as well.
Excellent.
So they can find me online.
And are you taking a special interest in mental health issues?
I do. It's so key. I see so many people with anxiety and depression, insomnia, seasonal affective disorder. So it's really important.
Excellent. Kids with ADHD as well, I understand.
Absolutely.
Good stuff. Dr. Campitelli, thank you so much for joining us with all the excellent information. Don't forget, folks, to send us your tweets. We want to know.